is Brian Potoski. I'm a clinical faculty at the University of Pittsburgh School of Pharmacy, and I'm also an antimicrobial stewardship pharmacist at the affiliated academic medical center. I graduated from the University of Pittsburgh with a Doctor of Pharmacy and completed a PGY1 in pharmacy practice and PGY2 in infectious diseases at The Ohio State University. So what inspired me to choose pharmacy as a career really kind of dates back to when I was in grade school. At the top of the hill, we would walk to school every day, and at the top of the hill there was a little community practice pharmacy, and my friends and I would always go in, and I was always fascinated by what the pharmacist was doing. And the older I got, I thought back to those experiences, and it really got me intrigued about pharmacy and what pharmacists do and the value that they provide to people like my parents and just everyday people. And so I pursued that as I got older. A typical day for me really involves evaluating antimicrobial therapy in patients in the hospital that I work in. We have a team of antimicrobial stewards, which are pharmacists like myself that are trained in infectious diseases and antimicrobial stewardship. And really that term just means using the right antibiotics or antivirals or antifungals in the right situations for the right infections in the right patients. And so the typical day for me involves reviewing antimicrobial therapy, evaluating doses, durations of therapy, drug interactions, to make sure that we're doing the right things for our patients. I think the favorite part of my job is that my day from day to day is very different. So I like the variety and the variability. But more specifically, what I like about that is when we look at antimicrobial therapy for patients, there's not a one-size-fits-all model. So when we look at what antibiotics to choose, it really depends on that individual patient. I think some folks might think about pharmacy and antimicrobial therapy as a one-size-fits-all approach, and it's not that at all. So what I really enjoy is discussing patients and patient care with my colleagues, my multidisciplinary colleagues, and identifying what the best approach is in treating those patients. And I think that's very, in my mind, that's very rewarding for me because we're developing a plan for each individual patient. I think the advice that I would have for people that are interested in pharmacy as a career would be make sure you take the time to get a sense for all of the roles that pharmacists can play in healthcare. There's a large number of roles. It's much, much more than just the pharmacist in the community or the pharmacist in the hospital. There's a large number of roles. There's research, there's investigational drug. There's so many avenues of care and pursuits that pharmacists can take. And so I would just encourage people that are interested in pharmacy as a career to make sure that they have a good understanding of all the available job opportunities that exist and kind of career paths that exist in pharmacy.